Hi, everybody. I'm Susan Clinton, one of the hosts for Tough to Treat, and I'm here with my co-host, Erica Mello. Happy holidays, Erica.
Happy holidays, Susan. It
So
is, God, I
we're
was just looking at
sitting.
our episodes, and this is number 230. Can you imagine? Well, I can imagine. I
So,
keep saying that every time we do this, but it just blows my mind how many hundreds of episodes we have so far. And that reminds us that, I think when we were at CSM in February, and I think you mentioned this recently, that people still don't actually know that we have a podcast, right? Or they do and they don't know the name. And so uh I think it would be great for all the listeners who've been listening for a long time and for new listeners to share the podcast with their colleagues or even their patients. I mean, I know this is more of a clinician podcast, but I do have a few patients who do listen to this, to
hmm
listen to us actually, and it just opens up their eyes. And I think that's a good idea, don't you? Just if you share it and go back and listen to old episodes because
hmm
there's a lot of good clinical pearls.
Yeah, when we say old episodes, it's not like old school or old
Right.
medicine or old stuff. It's just that they were in our past. Yeah,
Yeah,
episode 59 is as good as one that comes out of
totally.
episode 209. I mean, they're just at different times and different clients and different things.
It,
So I think there's a lot of wealth in that, in the history there with our podcast. I totally agree. I also think if you're going to share it, please tag us so that we see that you're sharing and we can chime in and be part of the party. So we're
uh,
just doing that as a holiday ask of everybody as you go back and listen to some old episodes and remember and enjoy your holiday season. So this is the end of our season. We started doing seasons this fall in 2024 to give Erica and I some time for some other adventures and ventures that we are involved in. And we wanted to keep the podcast high quality. And so we decided this fall to do a season. And so we did a collection of some really, we think, great stories and put them together in the podcast. And today we're just going to wrap it up by asking a few frequently asked, answering, not asking, answering a few frequently asked questions
yeah.
that have come up in the last year or so
Mhm.
by you, our valuable listeners. And so I'll start with the first one
You go ahead.
is what courses do we take? What courses actually do we take to make us who we are?
Yeah.
And I can be happy to answer. I've taken many courses over the years, but I have to tell you, the most valuable teacher I have is the person standing or sitting in front of me or next to me that comes, and wants to work with me. Hands down, if it wasn't for my clients, I don't think I would be the person that I am today.
Hmm.
But my clients' willingness to work with me, allowing me to lean into their knowledge and what they know about themselves, to understand their expectations, to hear what they're afraid of, to hear what they so very want, and to work with them to find a way forward has been the most invaluable experience. Courses are great for knowledge, but the clients are the ones who will challenge you to put it to use in creative and relevant functional ways. And I just want to say that out loud. I don't think you can go wrong taking a course. I absolutely agree. Just depends on what you're interested in, but it's how you work with the person in front of you.
Yeah.
Because a lot of people, we all take courses and we're only going to retain a certain percentage of it unless we're doing something that requires us to actually put it to use, to talk about it, to create it, to, have people to, uh, problem solve with it. This is why Erica and I started the podcast. I don't know if everybody knows, we started by just talking to each other about our current caseload.
Yeah.
Karen Litzy connected us
Yeah.
and met Erica for the first time in person at the Women in PT Summit, but we had been on the phone, talking to each other before that. And, that's how it grew. It was like such a valuable experience that our business coach, Christine, is the one who said that we should make a podcast, of which I was like, no, I don't want to do a podcast. I don't even know how to do a podcast. So we got on me kicking and screaming. We got on and just recorded on Zoom and just we
Yeah,
figured
yeah,
it out and started asking questions, and I don't
yeah.
know.
And,
But our hope is that it's been a great resource for everybody.
yeah,
And the value I want people to hear from this is that we're talking about this in ways that are improving each other's practice. And this is what I think everybody we should all be doing more of, and I know it's a pain to find somebody and get on the phone and just go through, cases with. Doesn't matter who they are. It could be Erica, it could be it could be both of us together if you want to come on the podcast. But just the value of working together with somebody. You don't even need to have them right in your clinic. You can just make a meeting every so often and do it. You gain so much from it.
yeah. And I know years ago, speaking of Karen, we used to have a little study group here in New York where we would talk about cases, but um, I can sort of list courses, but I also think that like our entire podcast library is a course in and of itself.
Hmm.
I mean, I'm being truthful. You go back to episode one, I think it was the cranium, one of my guys with
Hmm.
the cranium. I'm not sure if it should still be on Apple Podcasts. If you're interested in that and it's not there, just let us know. But every single one of our episodes, we've never repeated a patient. We would never do
Right.
that.
Right.
But these are all courses in and of themselves. The entire podcast is a course, basically, right?
Hmm.
So, and how we, Susan and I clinically reason, it comes from our different backgrounds, but we both come to the same conclusion. And
Hmm.
I think that, I'm a very analytical brain. And I was telling somebody recently via email, I said, you have to take courses that work with how you learn. I'm a visual learner.
Yeah.
I do like to be in person. That's why the pandemic was so hard for me, because it was on Zoom, virtual for me. And I learned a lot during that time, and I became a better therapist by doing that. There are a lot of people who say, well, I can't go to a place. Well, yeah, there are a lot of online courses you can take. You and I both have them, right? And they're amazing courses. It just depends on, for you as a therapist. And I recently received an email from somebody who had asked me, and I listed 3 courses, and I'll just tell you what I wrote to her in no particular order. Okay. Just because I'm in a different part in my career right now. Okay. So you're never going to go wrong with Lorimer Mosley. Okay. I mean, the guy's hands down an amazing pain scientist. And I took one recently here in New York, and I know Susan, you have as well. And you just can't go wrong with anything coming out of Australia with him. And I've, taken, it's no secret, I've taken a lot of courses with Diane Lee and Linda Joy Lee, LJ Lee out of Vancouver. More recently, I'm in LJ's certification. A lot of resources on the thorax. She's got virtual stuff as well. Amazing resource. And then Shirley Sarman, of course, you cannot go wrong with either. I've taken a lot of courses over there, but I agree with you, Susan. Your patience will make you more curious, because there are times where I'm like, I don't know what's going on. How am I going to figure this out? And it will inevitably lead me somewhere, whether it's a course, whether it's an online resource, or something else, right? And I, because I'm a curious person by nature, and I think our patients will, what's the word? They will lead us to areas of this profession. And if we follow those are going to be areas that are being very interesting for us. So my point is that if someone says to you about, I have a hard time breathing. I had a patient last week, and I think I mentioned you to her. She has a hard time breathing, has a hard time with speech when her neck hurts. I'm like, oh, geez, that's interesting. The speech part, right? So Susan and I got on a quick call and talking about the trigeminal system. You're not going to learn a lot of that in these courses, right? You're going to have to look. And I know you learned a lot with Earl Petman about that
Hmm.
years ago.
And mainly conversational, like us
Yes,
comparing notes
exactly.
and clients and doing things together, because Earl was one of my mentors through my
Yeah.
manual therapy work. which quickly became less about manual therapy and more about clinical reasoning and listening
Yeah.
and other things. So if you guys are interested in what Erica was talking about, for instance, we have courses, we have those little mini courses in the podcast on the trigeminal system, and you can just, I learned about it and I thought this is what all of my, you know, central sensitization, widespread pain, people who everybody tells them they're crazy.
Yeah.
This is a system that's involved here. That's what led me to my VOR work
Oh,
and
yeah.
how I needed to like apply that in. When people are like, you do that in pelvic health, and it's like I treat people.
Mhm.
that have pelvic health conditions, but I also treat people with chronic low back pain and people with plantar fasciitis, which, by the way, I think is still more neural tension and not a
Yes.
pathology in of itself. And but I treat people who have systems, and we look at systems, and if they can't stand on one leg, then that's going to disrupt a lot of systems in pelvic health and musculoskeletal and, all of it, because their balance system is off or something has happened. And so
Mhm.
I really think that, like you just said, I can name a few courses too. I mean, I can go back to, all of Jessica Drummond's work and the Integrated Women's Health Institute and, her coaching program, has really improved my work in biopsychosocial, I mean, motivational interviewing. But, manual therapy, again, my mentors were was my big mentor was Earl Petman through the NAOMS, system before he became Aspire. And then, just before that was, visceral mobilization and cranial sacral therapy, if you will, myofascial work. All that when I first started doing this work, I learned it from a physician. I didn't start learning, there weren't all these courses, and they're good. These courses are good, but they're courses, and how you apply to your client, I think, is the thing we're trying to get across here. You know, just doing strength capacity isn't going to tell the whole story.
Mhm.
I'm just thinking about, let's talk, pelvic floor muscle training. It's still the gold standard for, stress urinary incontinence when it's applied into the system in the right way. Is that what's needed first? In some cases, absolutely. But is it needed laying flat on their back, or is it needed at the end of the mile 5?
Yeah. Mm.
When, how, where, what is happening with this person? And making and working with what we know and working with them for it to be relevant to them, to help them achieve what it is that they want to achieve. And I think for both of us, we do work on impairments, but we don't think in impairments. We think more in like function and, what is this person really trying to do? Show us what this looks like and let us start changing the way your motor system may be working around that.
Mm. I also think that my first course out of PT school was PNF with Vicki Johnson at Staten Island Hospital here in New York. I was like, and it just depends on the areas that you're interested in. And I think that like you do an inventory would be my advice for people. And just do an inventory of certain patients you like to treat. Who do you look forward to seeing, right? And that'll help you. And I also think that for me, having a mentor, like I mean a mentor that you actually physically, schedule a phone call with, maybe once
Hmm.
every couple of weeks or once a month. You and I did that mentoring program during the pandemic. Remember, it was a
Hmm.
great time in the first couple of years. Everybody was home. And so having like a mentor, I would say for your clinical skills, I would say stay in this field, in the PT field for that. But you're going to gain a lot more from talking to a mentor. This is my opinion versus just going and sitting in a weekend course.
Hmm.
I had to choose between the two at this point in my career. I would choose the mentor over the course. Yeah, you need the course, but the mentor, because we see such tough people, the clinical reasoning piece is significant. If you're
Hmm.
treating somebody's foot and they have foot pain and the foot's not the driver, you have wasted your time. And so that's my point.
Hmm.
You
And
know,
some of this, the clinical reasoning piece is just, it's it's experience, it's experiential. And I know the frustration comes in. I don't have enough experience to know what to do. It's like you absolutely do, because the only experience you need is to ask questions. Get super curious. Why are they, their foot is bothering them? I did this stuff. Their foot should be better, but it's not.
Right.
Why? Just ask yourself why. What have I missed? What do I need to look at? And this is the power that Erica and I've always talked about, is that we video and photograph everybody. And I don't just look at those. We, like my client and I look at it,
Mhm.
and I ask them, to let them figure it out. 9 times out of 10, they'll say, I wonder why it's weird what I'm doing here. It's
Yeah,
like,
and they
tell me about
self-correct.
that,
Yeah.
And then, of course, timelines are, that doesn't require any experience to ask people what's gone on in their lives,
Mhm.
what got them
Yep.
there,
Mhm.
what's keeping them there,
Yep. What
those
set
types
them
of
up,
things,
right? Remember that CSM? What set
right?
them up? What
Yep,
kept
what
them
sets
there?
them up. Yep, what got them there, what's keeping them there.
Yeah.
And, and what's now happening, and what is this now creating? Like, what does the adaptation look like?
Yeah.
And is it a good one, or is it a not so good one?
Yep. Yep.
Is it causing them problems or not causing them problems? But you're absolutely right. You can't go wrong with Lorimer Mosley. You can't go wrong with Paul Hodges
Oh
and a
yeah,
lot
of
of work.
course.
But there's a
Yes.
lot of other researchers, young and upcoming out there,
Yeah.
that are putting out some really good stuff.
Yep.
There's, I think in the pelvic health world, there's, Linda McLean is doing a lot of interesting work with the whole pelvic health thing out of Canada.
Oh,
Um, Sinead DeFore
oh
is,
yes.
doing
Today's
amazing
great.
stuff. And of course, all the people in England and elsewhere, Ireland
Yep.
and Australia and New Zealand, all of the, but in Canada, like the
Yep.
other day, I sat down with Carolyn Van Dicken. I know
Yes.
most of you know who she is. Maybe a lot of you don't. But she's a master in persistent pain, and
Hmm.
she's a master in learning how to really track it. Like I've
Yeah.
always said, it's really hard to change what you don't track,
Yep.
because you don't know.
Yeah.
And a lot of people will use an inventory or one, but she's, and we talked about these in the podcast, the sad cliffs.
Yep.
And, certainly if you need information on that, I can point you to my newsletter that has, what those look like. And there's newer ones coming out that are even more sensitive. There's
Mhm.
now a visceral sensitivity index,
Oh,
which
interesting.
which they call gut directed anxiety, but but we have to name everything some name. I don't understand why, but it's a visceral sensitivity index.
Yeah.
It
Yeah.
can help people pinpoint, like, why is this a bother to them,
Yeah.
and
Yeah.
what's going on there. And people can have issues and not respond to them because they're not painful issues.
Yeah.
Most of the biggest drivers that bring people to us is pain, because they're just not going to pay attention otherwise. So I know preventative stuff is great and everybody wants to, jump up and down about it, but it's not on the forefront of many of our clients' brains. It's just,
No. No.
think about your own busy life and, things like that. And what you would do and what you wouldn't do, which brings us to the question that everybody likes to always ask. How much time does it take?
I know. It's funny because I mean, you're saying the patients, right? Yeah. I mean,
The
I
patients
always,
and the people that write to us that are therapists
yes,
as
yes,
well
yes,
too,
exactly,
yeah.
exactly. And I always tell, like, it's pay, I always say it depends because if the patient's had a problem for a very long time, I mean, there are people that I treat that I've been seeing for over a year, but their attendance is not great because of travel and things like that. But a lot of people, when they find a good physical therapist, they will say, I'm going to come once a month now because I feel good, but I want you to keep me good. And that's so true. I do have those people actually,
Mhm.
because they want to develop one of the qualities of my ideal client is that they want to develop a relationship with a physical therapist. That's one of my criteria for my ideal person, right? And not just, come in for 4 visits and see you later. That's not my thing. Okay. And, I've been asked a bunch of times how long my treatment sessions are, et cetera, et cetera. And I'll just say it here for the record. I try to evaluate, because I can vet the person first, right? So if I find that they're going to be really difficult, which a lot of them are in my case, try to schedule 90 minutes. I really do. Because the history is like 30 I take 30 minutes on a history. And if I can't do that, I will finish it up the second session. My treatments are an hour. So that should answer all the questions out there. But the history is very, very important
It's
because
everything.
it's everything.
It's
And
everything.
eh,
And they need to be heard.
yeah,
So taking a history and not directing it is also important. And I know I'm going to hear from everybody going, but my clients go on and on and on and on and on, and it's because everybody keeps cutting them off. And there's a way to ask questions curiously and empathetically without cutting people off. But you got to get to what it is that's going on. What do they want? What do they think is happening?
that's
And what
important.
in their heart of hearts, are they seriously worried about?
Mm,
And that's where the history comes in. And then the timeline is so important.
mm,
And,
mhm,
looking at it like, this may be a situation that has been going on a long time. It's just become acute for them now.
mm,
And they
mhm.
haven't put it together with everything that's happened before.
You see, they're not
And
going
it
to connect the
helps you have
dots.
that conversation with them like, look, this is happening now, but it got set up way back here.
Exactly, exactly. And I think that our job in that first session is to help them make the connections
Yeah.
in their body so they can connect the dots. Do we
Hmm.
get the buy-in? Yeah, it would be nice to get the buy-in, right, on the first visit, but sometimes we don't. We have to wait, right? But you need them to be able to connect the dots. And explain to them, like I just saw my patient last week, the one with the speech and the jaw stuff, and I was going to email her, and I was like, you know what, I'm seeing her tomorrow, so I'm gonna have to, because she was one of the evals I saw last week that I could not do 90 minutes on. She had a time constraint, and I did not finish. I finished, but it was tight, and I was decided that I was going to wait to explain things to her in person so she could help connect the dots via
Hmm.
a unpersonalized email. And I think that's really important that they understand why I'm going to treat certain areas of the body, because her neck is not her driver,
Hmm.
not her driver. And I had to present a case study this weekend for LJ Lee certification, and it was on a tennis player I'm treating. His timeline, Susan, was
Hmm.
so short. And I think sometimes we think about people who have very long timelines, and they can be very complicated. This
Hmm.
guy did not have a long timeline, but he had a significant movement history in tennis. And so his timeline was short, and is top five tough for me on many levels, for many reasons, for attendance, for different things. And so, uh, I think that don't be afraid if someone gives you a long history. You need to do that. You need to spend that time. And I know that, especially I recently taught um, a lecture here in the city about a month ago, and I asked how long these were students, and they're on their clinicals, and I said to a girl, I said to the class, how long do you get for evals? And people are like an hour. There were a handful of students in the class that said they had 15 minutes. I was like, excuse me? You can do an eval in 15 minutes. Are you crazy? That's a functional range of motion thing you're looking at that point, right? But even when I graduated, which was a long time ago, I at least had a half an hour. I always had an hour because I was very picky on where I worked, but 15 minutes is outrageous, outrageous. And I know most of our listenership does not have that. They have more than that time. But the point is that you really can't develop a therapeutic alliance with them. You can, but right in 15 minutes. And I think that's tough. That's really tough. And so I think I think the reason why we wanted to do this episode was just, to not only to just answer some emails, but um, look at think about, this is my advice, and I'll just be my parting words, and you can do your parting words, but I think it's just think about what patients light you up and what ones you're really interested in. And I find myself going to buy books on breathing. Okay, that's great. It's an area of interest of mine. I will learn a lot. I will tell you this, Susan, I go back and listen to old episodes of ours. I really do. Because I've learned as that we've been doing this a long time, I learn every single time, even if I listen to the episode more than once. I
Mhm.
learn. We learn from each other.
Mhm.
Um,
100%. And I think my parting words are, let the client guide you,
yeah,
really get to know what's happening and allow yourself to be more curious because they have a wealth of information inside of them. Nobody ever asks them, "What do you think about this?" They're used to being told what to do.
yes,
But when you can start getting them on board with what they really know and what they don't know and what they understand and what they don't understand, then it's much easier to develop a plan together about how are we going to fill in these holes.
yeah, yeah,
And, what do how are you going to tell me about your day? People give out so many things that people just can't accomplish in a day. There's no way.
yeah,
So I think just like using those tools like Erica just talked about in this as ways to kind of make decisions about, hmm, maybe this is where I want to go and this is what I want to study for right now.
yeah, yeah,
But the main thing is that open yourself up to being curious. You will find a wealth of creativity that you didn't know existed
yeah,
in your brain, and you'll find it in your clients too. And you'll have so much more fun, which is what we want because
yeah.
we need good people out there doing the good work to move us all forward.
I know. And I also think don't be afraid to make a few mistakes. I mean, at the end
Yeah,
of the day, you got to
test,
practice.
retest.
Exactly.
It's the
Is oh,
scientific
that's
way.
worse. Yeah. I mean, it is what it is. Don't get flustered. And I also, we also just the mentors. Mentors are very important. And so
Yep.
I'll sort of leave it at that. And want to wish everybody happy Thanksgiving, happy holidays, happy December. Hopefully we'll get some snow here.
And whatever way you like to celebrate the end of the year,
Yes.
one of the things that I would suggest you do is not look ahead just yet, but go back and really, 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 really talk about your wins. There's
Hmm.
way more in this last year than you even imagine,
Yep.
but celebrate those each and every single one of them.
Hmm.
Don't just slough them off as things that I did. No, go really celebrate those. This is the time as we move
Yep.
into the winter months. It's the time for deep reflection. It's the time for rest. It's
Yep.
the time for deep nourishment. The whole world goes to sleep, so to speak. And just take, at least in the northern part of the world right now. They flip around and they do theirs in the times that we're awake. But just take it in. Take it in, listen to an episode, ask yourself some curious questions, and allow next year to just bubble up like it should.
Exactly. Terrific.
Awesome. Thank you, everybody. We will be
Thank you for
back
listening.
for our season sometime in late January.
Sounds good. Yep. And thank you again for all of your loyalty and the viewers and the listeners. We really, really,
Questions
truly
and
appreciate it.
feedback. Yep. Keep us going.
Keep us going. Exactly.
Thank you, everyone.
Bye.